So, for those of you who don't know, 3 years ago I called Sam Seder of the Majority Report to try and talk about men's issues and men's rights. And the call really didn't go very well. They were very hostile and rude and dismissive. I put a link in the description below if you want to watch it. But I thought about something that Sam said that struck me as very, very hypocritical. And that was how, as soon as we talked about prostate cancer, he became very, very conservative on the issue of socialized healthcare. And what I mean by that is Sam Seder is someone who, if you look up his position on healthcare and medicine, he very much supports the idea of free healthcare and affordable healthcare. And he criticizes conservatives and right wingers that he perceives to be against free healthcare and that he perceives to be the reason why it's difficult to have affordable healthcare in America, the kinds of people who would be against programs for people to get healthcare in America. And yet, once we started talking about prostate cancer, and I covered how Obamacare, the Affordable Health Care Act, aka the ACA, doesn't cover prostate cancer, which is the cancer a non smoking man is most likely to die from, all of a sudden he does a complete 180 and he's completely fine and defends prostate cancer not being covered.
Under Obamacare, that women will get. Prostate cancer screening is also not covered under Obamacare. Prostate cancer is the cancer a non-smoking man is most likely to die from. The only cancer that kills more men than prostate cancer.
Dude, when do you get prostate cancer?
I'm sorry?
When do you get prostate cancer? What is
the
the age in which you need to worry about prostate cancer?
More men die of prostate cancer.
I understand. What is the age? What is the age?
What is the age I will get prostate cancer?
What is the age when men contract prostate cancer?
It is the cancer that.
No. I didn't ask you what the age is. I didn't ask you what the cancer is. I know what prostate cancer is. I'm asking you, at what age do you think you're most vulnerable that you really need the screening?
60 and above.
Yeah. Have you ever heard of Medicare?
Yes.
Okay. Obamacare, the ACA, deals with people who get up to the age of Medicare.
But not everybody is over the age of 60 when they get prostate cancer.
No, I understand that, but you also don't. You're not getting mammograms if you're a 25-year-old woman on Obamacare.
But a 25 woman can get breast cancer and die.
It's not about breast cancer. Women are going to the OBGYN for the birth of children and for reproductive health. Men cannot carry babies.
The point is the health needs. The point is the health needs.
Babies. But a 55-year-old man can still develop advanced stage prostate cancer, but he would not have screening available.
I understand. But, dude, you understand that the way that they determine these things is not a function of the possibility. It is the function of the likelihood. What you're complaining about is public health policy.
What's the difference between the possibility and the likelihood?
No, I'm sorry. Women spend, on average, from ages 19 to...
What's very interesting and telling about this, and this is something that's very common when you talk to feminists, and I hate to say it, but leftists, is notice how Sam immediately started to defend the lack of healthcare coverage. Exactly the thing that he would criticize conservatives for, he is now suddenly doing himself. He's making the exact arguments that conservatives use when they argue against socialized healthcare. Why? How did I get Sam to make this flip? How did I turn Sam into a conservative? Again, by making it a men's health issue, by making it a male health issue. Notice how the same Democrats and feminists who would say that healthcare should be free and socialized are completely fine with a major cancer, a major cause of death, being left out of coverage when the victims happen to be male. When it's a men's health issue, all of a sudden they are just fine with it not being covered. All you have to do to get people like Sam Seder to do a complete and instant 180 on healthcare is to make it men's healthcare. Think about it. Now, I know what his response would be to this video. He would say that he's not against prostate cancer being covered, it's because prostate cancer happens at an older age. Therefore, you already have Medicaid after the age of 65, so you don't need Obamacare to cover prostate cancer. This is a very common feminist line to hear about prostate cancer, that it only happens in older men, or that it doesn't kill you, you just die with it. But this isn't true. When you look at the statistics and the data on prostate cancer, and I've put the links down below so you can see, prostate cancer is a major cancer killer of men even before the age of 65. So it's either lying or bad math or bad science to make this argument. So just to prove the point, let's examine the data a little bit more closely. Here are the stats on prostate cancer deaths per age. Now, you can see that the number of men who die between 55 and 64 is 9.2%, and then a little over 1% of men die younger than that. So let's just say it's 10% of men die before the age of 65. You might think, oh, that's just 10%. But what does that equal? Well, 34,000 men die of prostate cancer every year. This is all for the United States. So 10% of 34,000 is over 3,000 deaths. Now, if you look at cervical cancer in the US kills 4,000 a year total. So 4,000 people die, 4,000 women die of cervical cancer every year in the US total. Whereas for prostate cancer, 10% of deaths is 3,400. That's almost the same as total cervical cancer deaths. So that 10% that Sam is ignoring is a very significant number. That's a lot of people dying, and that's a lot of people that could be helped.